All right, so welcome to the next edition of the Beyond the Blade podcast. We're here with our lovely Dr. Jennifer Miranda out of Pure Executive Health and Wellness, located in a very beautiful part of Miami, which is Merrick Park, which is a very nice mall that we all share. And she has a beautiful office there. And so she has been kind enough to join us today for a special session, a special topic, which is how do we optimize our patients for surgery? How do we educate them about what they should be doing, what they should not be doing, and the importance of really delving into this topic. If you're thinking about having any type of surgical procedure, you need to have a good relationship with your physician, and Dr. Miranda is one of our best in Miami. So that being said, I'm going to open the door to her to basically explain her background and how she came to this world of wellness.
Thank you. Good morning. And that was a lovely introduction. I'm Dr. Jennifer Miranda, and Miami born and raised. I did my undergraduate degree at Harvard University, and then my medical degree at the University of Miami, and my training in internal medicine also at the University of Miami. So I'm a board certified internist, and I focus on concierge and aesthetic medicine at my practice in the Gables. And part of that is helping surgeons like Dr. Zuri really know that their patients are safe and prepared for surgery and not going to have complications, hopefully, and do really, really well by doing a thorough preoperative evaluation.
Yeah, so that's extremely important, to have a physician who has a lot of experience. As an internal medicine physician, it's very different than some of the other specialties. So Dr. Miranda has that really in-depth knowledge regarding, all of the different types of diseases that could present, right? From the common ones like high blood pressure and diabetes, but also to much more complicated issues. So if we start the conversation for the audience, I know that everybody wants to know, what do they need to stop doing before they consider a surgery, and like how much before do they need to consider stopping these things?
Absolutely. And it's a great question. You want to be proactive and prepared, especially if you're considering a surgery or multiple procedures as part of a surgery. Right. And basically, the things that we as physicians would want to make sure they know to prevent any issues is to get rid of the things that are going to affect the surgery, affect the anesthesia, affect their ability to heal or to recover well. So that includes some vitamins, some medications, some bad habits, a lot of things that maybe they're not looking into as deeply as they should.
Exactly. And there's also a lot of controversial items that we can talk about too. So in general, Dr. Miranda and I always talk regarding our patients stopping things that are going to make you bleed, right?
Absolutely.
So as a surgeon, the last thing I want is a patient excessively bleeding on the operating room table. So can you give us some examples of the things that they should stop, that regarding bleeding, for example?
Absolutely. So any medication that's an anti-inflammatory, such as ibuprofen, naproxen, aspirin, all of those medicines, and there's various brands of those too. They're all over the counter, easy to get. They're in combination cold medicines. So you can have access to these sometimes without even realizing it. All of those are going to make your blood thinner and make it more likely to bleed.
Right, exactly. And, there are a lot of common things that, especially women that are going through their menstrual cycles, they don't even realize they're taking Advil or Midol or these products. And if you're taking them within 7 to 10 days before surgery, you really need to be careful because it definitely will increase your bleeding risk. I think we've also found some interesting cases of people drinking some herbal teas.
Yes.
And so tell us about that.
So some herbal teas can also have, because of the herb ingredients that they have, predispose you to bleeding or thinning of the blood. Similarly, too much fish oil or too much vitamin E, which can be great for general health, but not so much preoperatively because they can put you at risk for bleeding.
Right, exactly. So we give all of our patients a very specific list of the items that they should discontinue. If you're not sure, please either ask your physician who you're working with wherever you may live out of Miami. But if you're in Miami, please stop and see Dr. Miranda. She is excellent. She's going to go through all of your medical history. She's going to go through all of your medications, and she's going to tell you ahead of time. what to stop. One of the other things that we run into is how do we prevent blood clots or deep vein thrombosis, DVTs? So can you touch upon a little bit of that as well?
Sure, I'd be happy to. So that's a big thing as well. That is a complication that would be for after the surgery that we'd want to prevent. One of the best things to do is to get up and get mobile as soon as your surgeon says you should, and as much as possible, because moving around helps prevent the blood from staying in those legs and creating a clot. Also, sometimes, depending on your risks or other factors about your weight, the amount of time you're going to be in the surgery, your family history, all of that affects your personal risk for creating blood clots. And sometimes it's best to give people at high risk a blood thinner after surgery to prevent the formation of DVTs.
Exactly. So there is a score that's called the Caprini Score. You can actually go online and look at the breakdown of it and what constitutes a high risk or low risk patient. And so we use that as physicians to try to figure out, when we should be giving anticoagulation after surgery, when we shouldn't. Overall, thankfully, the risk of a blood clot is very low. But if you are a hypercoagulable type patient, or sometimes you're taking oral contraception and you don't even know that that's going to increase your risk of a blood clot after surgery. So we ask our patients to stop any oral contraception for at least 30 days before surgery, just to make sure that we're decreasing that risk. If you're interested in that topic, you can go very deep into the world of wearing compression socks and how long to wear them after surgery. And you can buy on Amazon these leg squeezer devices that you can wear at home when you're recovering from surgery. So there's a lot you can do nowadays for blood clot prevention. And I think it's a very important topic because of all of the complications that we have as surgeons. That is definitely one of the more concerning ones and that you should definitely look out for. Talk about a little bit about hypertension, because that's been an issue with some of my patients, especially men, when we're doing facelifts, neck lifts, tummy tucks. Actually, about a week ago, I had to cancel a surgery, with the patient right before we started because his blood pressure was like 177 over 100.
Uh-oh.
So what would you recommend in that case?
I think canceling the surgery was a good call.
Yeah.
We definitely don't want blood pressures running high. Yeah. 140 over 90, even though technically it's hypertension, we can deal with that for surgery. And the anesthesiologist can play with the medicines and the fluids to maintain a healthy blood pressure during surgery. But blood pressures are at 150, 160, 170. You're asking for trouble. Sometimes those anesthetic medicines might raise your blood pressure and then it would go way too high in surgery. You'd risk a stroke or a heart attack, some bad event, or even more bleeding. Those are not things we want to have in the middle of a surgery.
No. So please, sometimes you need to go through the work of getting a little digital blood pressure cuff and checking your blood pressures once or twice a day at home, for a month or so, and then taking that to your primary care doctor or your internal medicine doctor, because you want to know what your pressures are. And some people are medicated, but maybe they're not being appropriately medicated because the doctor doesn't really know what their blood pressures are at home.
Right.
They have the wrong dose or the wrong frequency or maybe even the wrong medication to really get them where they need to be. So if you're listening, please, do the due diligence, and if you're a hypertensive patient or you have high blood pressure, please monitor that beforehand. What about the diabetes, the hemoglobin A1C that everybody talks about? What are your thoughts on that?
So that's another really important way to help prevent issues after surgery. If you have poorly controlled blood sugar, a high hemoglobin A1C, diabetes that isn't optimally controlled, all of those things, which basically mean the same thing, that your sugar runs too high, are going to put you at risk for infections after surgery and poor wound healing. Neither of which you want, especially in plastic surgery.
No, definitely not. Yeah. So sugar control is very important. We try to not operate on patients that are insulin dependent in our outpatient surgical facility, because those patients have a much higher risk of postoperative infections, and also trying to control their blood sugar during the surgery, immediately after the surgery. Those are much more difficult cases, and we rather do those in a hospital setting, for example. If you're listening to this, you should really consider, if you're looking for a plastic surgeon, where he has hospital privileges. I happen to have them at South Miami Hospital and Baptist Hospital. which is literally across the street from my office. That's been very convenient if we want to do any hospital surgeries. So if you're a diabetic or hypertensive patient, I don't want you to just turn off the podcast and think you're not you're not a candidate, because the hospital is always a very good option for a lot of people. And you can stay overnight, and you can have a nurse, and they can be monitoring you. So don't take surgery off of the table completely. Just come and talk to myself, Dr. Miranda, specialists that can help you figure this out and navigate it appropriately. Let's talk about controversial topics.
Sure.
Before we got on, Dr. Miranda was talking about Ozempic. We were talking about Mounjaro. And we're trying to figure out also the cases of marijuana use and how that affects surgery. So let's talk about these injectable medications for weight loss. What are your thoughts?
So with all of these injectable medications, whether it's Ozempic, Mounjaro, Wegovy, or the generic ones, the semaglutides and tirzepatides, they're really helpful for patients to lose weight, get healthier, get their blood sugar under control, but they can also affect surgery. So we would want to stop them a few weeks prior to surgery. So, I think Dr. Zuri and most surgeons in the community really recommend at least 4 weeks, at least a month off of those medicines so that it doesn't affect your blood sugar or you don't have any issues during the surgery.
Yeah, and blood sugar management is a little bit tricky. It's a lot easier for us to control your blood pressure, for example, in general, for the most part, than to start playing with insulin and start playing with glucose and trying to figure out how we can stabilize your blood sugar levels. So that's the importance of that. We definitely want you to lose weight before surgery, right? Which brings us into the controversial topic of, what is the proper body mass index for somebody having a surgery, right? And this is something that we wrestle with as surgeons. I know you wrestle with it as well. What is the cutoff? What is the limit? Our studies in plastic surgery talk about a body mass index of 30 as really being the cutoff line, where if you cross that number, you may start to be in the realm of increased complication rates. Now, I think in the last 10 years, most of us have pushed the envelope a little bit beyond 30. My clinic's limit is around 32. And we've had very good results at that BMI level, thankfully. But it's not that I prefer a patient to be at 32. Ideally, you're at your body weight, the ideal body weight that you should be at, which Dr. Miranda can explain a little bit more about what would be ideal. But really, it ends up being based on your height, correct?
Absolutely, based on your height, and also, we can take into account some people are really muscular and maybe they weigh a little bit more, but actually they're quite fit and quite thin. Their BMI might technically be a little higher than other people's, but you can tell that it's a healthy body composition. And agreed, if you're going to do a plastic surgery to get the look and the feel that you want for your body, you should try to get to the weight you want to be at, or as close as you can get to it first. So then you can be really happy with the results after.
Exactly.
And the BMI of 30 is also a risk factor, as you mentioned before, for blood clots. It's part of the Caprini Score. Right. So it factors into a lot of the risks for surgery.
Yeah, it factors into the final result, the way you look, the surgical complications, everything rises. BMI of 30 is technically obesity.
Right.
Right. So, and that's not good for your heart, your lungs, your kidneys, all your organs, let alone, the stress of a surgical procedure. So we want to optimize our patients. When we talk to physicians like Dr. Miranda, we talk about how do we medically optimize a patient for surgery. And so all of the topics that we're discussing right now are optimization strategies. One of the controversial topics as well is the use of marijuana, which through the legalization in many states of the drug, we're seeing a lot more patients who are coming in for surgery that are testing positive for THC. I've always told patients, it is preferable that you're not under the influence of any drug before surgery, because when it comes to THC in particular, unfortunately, it has a way of causing you to require a higher dosage of anesthetic medication while you're asleep under surgery. And that's not good for you. It's not good for your organs, in general. And we don't want to risk, having to give you more and more and more anesthetic medication to keep you asleep.
Right.
So what are your thoughts on that?
I mean, nobody wants to wake up in the middle of a surgery.
Right.
That would be very, very terrible. Okay.
Yes.
But also, giving too much medicine to make sure you don't wake up after surgery makes it hard to wake you up later.
Exactly.
And can have long-lasting effects from the anesthesia and prolonged vomiting or other things that those medicines can cause. You don't want any of those things. And I think people feel that because it's not tobacco, that it's not as bad, and maybe they don't realize it could still have big effects for your surgery.
Yeah, definitely. And especially if you start to, use that substance mixed with nicotine.
Yes.
And nicotine is very dangerous. Nicotine, there are very, very clear studies on how bad it is for wound healing. If you're having an abdominoplasty, for example, which is already a procedure that is very taxing on the body in terms of wound healing, you don't want to throw in an additional factor like nicotine that can cause the dreaded word that nobody likes to talk about, which is tissue necrosis or skin necrosis. Necrosis is literally death of the tissue, lack of oxygen, lack of blood flow. And tummy tucks are sensitive to lack of blood flow and oxygen, so you don't want to add an additional stress. When would you consider recommending, stopping smoking before or nicotine use before or after surgery?
So I would say, similarly with the weight loss meds, at least a month it would be preferable. And then the upside of that is if you've been able to stop it for a month, you quit already. So do you need to restart? If you need to restart, I also would wait until you're fully healed.
Yes.
Because that part of the healing process is an ongoing process for quite some time after surgery too.
Yeah, and it's also been studied that it does increase your risk of infection. So you don't want to, really set yourself that far behind when you're trying to recover from any type of surgery. And it's not just abdominoplasty, that's just an example, but facelifts, neck lifts, any facial surgery, breast surgery, all the surgeries are very much affected by the systemic effects of nicotine. In terms of optimization, in terms of exercising, I get a lot of questions every day. How much should I be exercising before surgery? What should I be eating? Can you just give us maybe a general idea, maybe a 40-year-old woman, she's a mother of two, she wants to have a tummy tuck. What should she be doing the few months before surgery to prepare?
So I'm sure that's a very common patient that you see a lot in your practice. I see a lot of that patient in my practice as well. And generally, it's two things. It's eating a clean diet, as clean as you can get it, lower in processed foods, right? Things in boxes and bags and things like that. If you have access to it, organic or grass-fed, high quality, olive oil, omegas, avocado, those types of foods are going to really nourish your body and make you healthier for surgery and for your life in general. Also, exercise is really important. So you mentioned a mother of two. She's probably a little bit busy, but if she can fit in 3 or 4 days a week of a mix, I really like interval training. I think it's the best way to bring up your heart rate and train your heart to perform better.
Right.
Boost your metabolism at the same time. So also to trim down if you'd like to in advance of surgery. And you can do that in a 30 to 40 minute session. So if you have that amount of time, that's a great way to work out to prepare yourself for surgery.
Yeah, and sometimes it really does take a major lifestyle sacrifice, a lifestyle change in a lot of ways to be able to, make that routine of 3 to 4 days a week, to do, different types of interval trainings and things like that. But it pays dividends at the end. It's very important. It's good for your overall health, your psychological well-being, which is very important when you're coming into surgery. So we have this saying, the anesthesiologists and the surgeons, that the way you go to sleep, right before you go to sleep under anesthesia, the thoughts that you have, the anxieties or the nervousness that you have is going to be the same emotion when you wake up from anesthesia. And we see this every day. People that go to sleep calmly wake up calmly. People that go to sleep in a very nervous manner end up waking up in a very nervous fashion. So talk to us a little bit about mental health, because we've talked a lot about physical things, medications, diets, exercise. But what about the mental aspect of this whole process?
So that's a huge factor as well. We get a lot of patients, your preoperative patients, for example,
Mm-hmm.
that, we tell them, how are you feeling? And they're, I'm really nervous. I'm really nervous. Well, I think it's normal to
Yeah,
be nervous.
definitely.
It's a surgery. You're choosing to do it. It's a big deal. We're making you get checked before,
Right.
there's a process to it. All of that adds to the bigness of it.
Right.
So I understand being nervous, but it's also an exciting thing for a lot of people.
Yeah.
And if we can optimize you in advance and you feel safe and healthy and you're excited for the look afterwards and how you're going to feel,
Right.
really it should be more exciting than nerve-wracking.
Yeah.
Some things that can really help your mental health throughout this process can be as simple as breathing.
Yes.
There are breathing techniques that have been studied head to head against Xanax and
Wow.
have the same effect. There's a breathing technique called the 4-7-8. So you count in your head for 4 while you breathe in, you hold it for 7, and then you breathe out for 8. So it's a long exhale and a little bit of a pause in between. And if you do that a few times, your blood pressure goes down, your heart rate goes down, you start to feel a sense of calm. All of those things are little things, but if you practice them in advance of surgery and maybe in the preoperative area
Yeah.
right before the surgery,
Yeah.
they would put you in a better mental state for the surgery.
Definitely, definitely. And it's something as simple as changing the way that you breathe that can change your physiology and change your mental outlook. And that's hugely important when we're doing surgery, because I cannot tell you how many patients that they're a nervous wreck, coming into the surgery, weeks before the surgery, the morning of surgery. And if you've ever had a surgical procedure, and, I've had my own, it is definitely nerve-wracking. I mean, there's no question. For the surgeon, it's different because this is our day-to-day life, and we've been in this world of surgery and anesthesia and these things for years and years and years and years and years, becoming a surgeon and then becoming a plastic surgeon. And so for us, this is our daily life, and we're not affected by any of these things. But as a patient, we understand it's very nerve-wracking. So please, think about meditation strategies, look into yoga, look into, mindfulness, look into whatever, sparks your interest. There are a lot of applications on the iPhones or, the Androids that you can use to really help you, before the surgery. But I will tell you from personal experience, my best results and my least complications have come from patients that are calm, collected, confident, and trusting of the process. The flip side is a totally different story. Right? So, there is a very strong mental and psychological component and emotional component to plastic surgery. And I think people really neglect that when they're preparing for a procedure.
Absolutely. And I think you have to be confident in your decision,
Yeah.
and feel at peace with your decision.
Yes.
And then you can focus on, making sure the rest of you is ready.
Exactly. All right. So we really, really, really want to thank Dr. Miranda for coming on today to our podcast. We will have her back for sure. And then we'll do some more in-depth conversations about maybe some other topics that her and I can share. We want to give her an opportunity. If you're looking to see Dr. Miranda, if you're in Miami, or maybe you're coming from out of Miami, we have patients coming from Alaska all the way through Texas and New York, all over the United States. Thankfully, we have a wonderful out-of-state patient practice, where you can find her. But please, disclaimer, if you're going to come to Miami and you're out of state and you want to get a medical clearance from Dr. Miranda, please do not show up a day or two before the surgery, right?
Well, it's like everything we just talked about. This is a process. You're going to be preparing up to a month in advance or more for certain things. Same way, we want to check your lab work. We want to do an EKG. What if we have to optimize your blood pressure or do another test to make sure everything is okay? We need time to do it. Exactly. And the time will help you feel calm. So it all goes together.
Yes. We don't like doing surgery in a rush. We don't like preparing people in a rush.
No.
And we don't want people feeling that stress. And just like she said, that really spills over into the whole experience.
For sure.
So if you can, Dr. Miranda, let everybody know where your practice is located, your Instagram, your social media, how they can find you.
Absolutely. So my practice is in Merrick Park, which is Coral Gables, kind of right in the middle of Miami. And you can find us on Instagram at Pure Health Miami or our website, purehealthmiami.com. And you can text us, DM us. You know, we're very accessible that way through our office line. And we'd love to see you to help you prepare for surgery, to help you recover well after surgery. We have, you know, IV cocktails also of vitamins that have been shown in studies to improve healing, and to help you kind of get to the final result you want even faster, even better. We have a hyperbaric oxygen machine that we can use to hyperoxygenate those wounds, those surgical wounds that are healing, to make them heal even nicer, for a better result. So we'd be happy to help.
Amazing. Well, thank you so much, Dr. Miranda, for coming on.
Thank
and we hope to
you.
have you again soon. Thanks again.
Have a great day.